Kate, sorry for I had like a tech delay.
Oh, you're okay. No worries.
Yeah,
No worries. Yeah.
wonderful. Well, what would be most helpful today?
Yeah. I kind of just, you're probably getting this a lot, but just want to know that I'm on the right track right now. I don't know if the lack in referrals or inquiries converting to actual clients is because of something on my end or just like the times right now. So,
Yeah.
uh, Yeah, so just some of that. So I started my practice on my own last April, a year ago. Before that, I was in a group practice and I got to bring some of those clients with me. So I did not start from scratch. But yeah, started my own practice then. And my niche then was like women and adult women with people pleasing and anxiety, and doing EMDR with that. And it was kind of a slow summer last summer, building up a little bit, but I didn't start from scratch, thankfully, having those clients with me. The fall was really busy, and then like December was a little less busy, and I took time off for the holidays. And then since January, it's been like scary slow.
Uh-huh.
So, a lot of clients graduated and met their goals, and that's great in like January, February, but no one has been coming to replace them. So, or maybe like some consultations, but they haven't, converted, or been a good fit. So, um, and I have, so I'm seeing like 8 to 12 a week, basically, since February. And I need to be at like 15 a week to even like breathe financially. And
Uh-huh.
20 is my goal to thrive. Um,
Okay.
I'm on one insurance and it pays pretty well, honestly, but I'm terrified of clawbacks and audits. That hasn't really happened yet, but really scared of that. So love to be off that eventually. But not getting any private pay people right now. I mean, I have like two or three out of the 8 to 12. And they came to me because they thought I took like an off branch of their insurance and I didn't, and they stuck around anyways. So yeah, I don't really want to leave insurance until my marketing's where it needs to be able to get in private pay clients. So for some reason, I'm only bringing in people that happen to take that one insurance I have, and then it's like, would they have reached out if I hadn't been taking the insurance? So I'm always wondering that. And I've also changed my niche a couple times this year, and I feel like I've finally fallen on what I want it to be. But I realized earlier this year that I wanted to do like recent event traumas with EMDR.
Uh-huh.
Felt like that was too broad. So then I dove in more to recent traumatic grief and loss. Um, oh, are you there?
I'm here. Yeah.
Okay, perfect. Sorry, you first for a second. Yeah, recent traumatic grief and loss. Again, felt like that was a little bit too broad. I've had clients come in with both of those things, a recent loss or traumatic event, and I've loved working with it. So, but both of those things I felt like were kind of too broad. So recently, I've been networking with because of those two niches, a lot of like perinatal providers and postpartum and all of that. And it kind of has like made me realize I want to do a lot with the like perinatal, postpartum, like that, because it's a mix of grief and loss and recent trauma. So my new niche right now is women who've experienced a traumatic birth experience. Uh,
Got it.
so I feel like that's pretty niche down. I mean, I don't have to
Yeah.
go further into like just miscarriages, just the birth experience itself, or but in general, yeah, just traumatic birth is what I'm at now. And I do have a kind of like a sub niche on my website under a services page of like just a traumatic perinatal experience, whether that's a loss during the perinatal time. But my homepage is mainly just traumatic birth experience, traumatic labor and delivery, and all that. Um, so that's where I'm at now. So I have only been with that niche for like 3 weeks. So I guess it is pretty new. But all this year, though, as I've been doing, whether it's recent events or grief and loss, a lot of networking, a lot of all of that stuff. And I still am, but I am at a new niche right now, just in the past couple weeks. So either way, though, it has not really brought in any of those niches or networking that I've been doing very much. So I guess I'm just was trying to see, I wrote down questions. Um, I mean, I'm doing a lot of the trying to make sure I follow up with people, like not just reaching out one and done, you know.
Right, right.
I've created a couple of my own consultation groups. I was already in two. I mean, they all only meet like once a month. I was in two already of the other people invited me to a while ago, and then I created an in-person one with four other therapists, or four of us total, and we're all in like the beginning stages of our practice. So that's been really nice. And
Uh-huh.
I made another one with a couple other therapists who are a bit further along in their practices than I am. So that's been really great. And I'm fully virtual, so I really like the connection. Like I've genuinely enjoyed, like I make sure I reach back out to people that I actually enjoy talking to and could be friends with.
Good.
So that's been
Yeah.
great. So yeah, that's been good. But and I've been meeting with people kind of, outside the box of just other therapists or psychiatrists. I've met with when I was doing grief and loss more so, I met with like some funeral home directors. I've gone into some concierge doctors' offices in person, dropped off like coffee and my info. Only got to talk to the front desk staff and never heard back from the actual doctors. But I've met with yoga and Reiki instructors, recently some doulas. I reached out to some birth centers and they're getting back to me. So lots of that with the perinatal stuff, a lot of psychiatrists that work with the perinatal population, a lot of in-person stuff though, thankfully I'm able to do. I feel like in person just, it's a lot, but I feel like I connect better with the providers when I see them compared to virtual. So yeah, I've been doing a lot of that, still some other places to reach out to, but Facebook groups, like mom Facebook groups, I feel like I got a couple consultation requests a few weeks ago from there. They haven't panned out. But I'm still researching more of those. There's a couple that you have to like pay to advertise on, so I'm doing some of that. But yeah, so I don't know if there's other ideas that you would have, or if it's one of those things where I'm doing the right stuff, I just have to wait. It's just hard to know, like, what if I'm not doing the right things? I won't know until 6 months from now, and then I'll be wasting all my time that I've been doing these things, and maybe they're not the right things to do. Um, yeah, I don't know.
Yeah. Well, I think part of it is when you change your niche, if you're not already established, when you change your niche, it's like hitting reset.
Yeah.
So
Hmm.
you've got a 3-week-old practice right now.
Hmm.
And that's like, you know, you do have some clients, so that's good. It's just getting the word out with this very different niche than where you've been in. And your niche starting out in private practice was the kind of niche where um, a therapist who has room in their practice will take that person.
Right. Hmm.
Where like I would take the person in your initial niche, but I would not take the person in your current niche. I'd be like, you need a specialist.
Hmm.
So um, I think that there's like a really beautiful specificity to your niche now. The other niche is great. It's just people are
Hmm.
going to gobble them up too.
Right.
So I would say also networking with just other therapists
Yeah.
who are not perinatal therapists.
Hmm.
Um, I would also like your website, has it been completely retooled?
Yeah. Hmm.
And okay, good, good.
Yep.
And how were people finding you before? Like in the fall when things were busy and new people were coming in, how were people finding you?
Yeah. So, online directory, I was with Psychology Today for a while. So I had gotten a lot through there, but it dried up like again late fall and
Oh,
just feel like it's not so I canceled it recently and I went with Therapy Den and Therapist Tribe instead, just recently.
mhm.
So it used to be that, but again, that dried up really quick. And then other therapists were finding me. So like who had a talk therapist or art therapist or therapist for OCD was finding me so that their client could do EMDR with a specific trauma. So it wasn't based in like whether it was a recent trauma or birth trauma, just like kind of a general, whatever it may be, a specific trauma. And they found me. But I think that's happened a lot, but every therapist who's done that and referred a client to me, they've been like, oh, yeah, I saw you took Blue Cross Blue Shield. So
Uh-huh.
it was because I take the inch. So it's like, how would they have referred to me if I didn't? I don't know.
Yeah. Well, and right now you want to get your feet under you marketing wise
Right.
anyway. So it wouldn't, if things are slow like this, now's not the best time to get off
Mhm.
insurance.
Yeah. Hmm.
So let's leave that as like a little safety net. And
Yes.
then once you feel like, okay, things are like people are coming in at a regular, like reliable clip,
Hmm.
then is a good time really to
Yeah.
consider
Yeah.
getting off insurance.
Hmm.
Um, And do you live in a place where Blue Cross Blue Shield is like very common?
Yeah.
Okay,
Hmm.
good.
Yeah.
So then that probably also means there are lots of other therapists who take it. And so it's like being found,
Mhm.
probably. Like all of this
Yeah.
sounds like it's about being found. And you're doing a lot of good networking that helps with that.
Yeah. Yeah.
Um,
Yeah, I'm in an area where I'm in Northern Virginia, just outside DC. So I'm in an area where like private pay is pretty popular, and but if someone's with an insurance, Blue Cross Blue Shield's a big one here. So and a year ago, I knew I didn't move here till August, but I knew I'd be moving here when I started my practice last April. So I was looking around at therapists here and what they charge private pay, and it was like 250 at least. So I was
uh-huh.
like, oh, okay, so I didn't start with that. I've gone back and forth a lot with the private pay rate. The highest rate I'm charging right now for private pay people, I have a couple at like 190. But this January I upped it. Upped the new for new people coming in, the private pay to 250. Um,
Good.
but I don't have anyone at that yet. But I will say when I was looking around in like earlier this year again at what therapists were charging, everyone is charging like under 200, and I don't know if people lowered their prices or if I'm just finding different people than I saw a year ago when I looked, because a year ago it was like super up there, and now when I look around it's under 200. So
Hmm.
I don't know what that means, but
Yeah, I doubt that it's people lowering their prices
okay.
because it's like once you have a caseload of people paying,
Right.
it'd feel really weird to
Mhm.
lower it for newbies.
Mhm.
Um, So I think it's probably like so many more people have gone into private practice.
Yeah.
And like on Psychology Today, for instance, like the
Mhm.
timing of it kind of tanking for you makes sense to me because that's
Yeah.
when like the big therapy tech started creating all
Right.
these Psychology Today profiles and bumping other people out.
Mhm.
Um, so that makes sense.
Mhm.
And it isn't anything you did. It's
Right. Yeah.
just
Yeah.
big
Yeah.
therapy techs trying to take over and we're not going to let them.
Right.
So,
Mhm.
because so like our clients don't want to go there. They're not
Right.
going to them. So,
Yeah.
okay. So I'm hearing good networking.
Mhm.
Doulas are great for your current niche. I would definitely get in with some OB-GYNs,
Mhm.
some midwives.
Mhm.
Um, and honestly, some of them may want to see you because it would be
Yeah.
extremely
Mhm.
traumatic
Right.
as a provider.
Mhm.
Um, Even when you've lived through many of them, there are still some that are going to get stuck, you know?
Yeah. Yeah, and I've wondered if I could make that. I mean, I don't want it to do any harm to me with my niche and whatever it may be, but I wondered if I could make that a sub thing, like a service page under my service pages, like people who work with birth trauma.
Yeah.
'Cause someone did ask me, they haven't reached out for services, but they said something like, "Do you work with people who work with birth trauma?" And I was like, "Yeah, sure." So,
Hmm.
yeah.
Yeah. So I think having that sub niche, like having a page devoted to that would be really powerful when they ask. You can be like, absolutely, here's a link to my page that talks about how I work with folks.
Hmm.
And then it's like, oh, you're not just saying, sure.
Right.
You're like, absolutely, I specialize in what you're struggling with.
Yeah, yeah, that makes sense. Yeah. Yeah, I still need to do the OBGYNs and midwives. I tried to get in, or I thought about doing like, and I have a few people who have an in with the hospitals around, so that could be helpful, but it's so hard to get in with like, 'cause I even figured social workers I know they're social workers for like the NICUs and
Uh-huh.
getting with them. I tried to call the other day and got disconnected, and so I don't know, but I mean that might be a good one too. So.
Yeah. And it depends on what services they have in-house because they're
Mhm.
not going to refer out if they have
Right,
any in-house services.
right. Yeah, yeah. So yeah, it's like, is that a waste of time or not? I don't know. But yeah, birth centers, there's a couple around. Um, Psychiatrists I've met with that work specifically with postpartum, perinatal,
Right.
that group. Pelvic floor therapists I haven't reached out to yet, but I've heard those are good ones to reach out to. People have told me.
Absolutely.
Yeah, so I need to do that.
Lactation consultants, did you list them?
Yes. Yes. That's a good one. Yeah. I've talked to a hypnobirthing
Hmm.
place. I've talked to someone that does like infant massages. Yeah, so a lot of like outside the box, that I feel like would be good to reach out to. So again, it's only been like 2 weeks and I know it takes
Uh-huh.
time. I just want to make sure I'm doing the right stuff. So yeah.
Yeah, another good one would be cranial sacral therapy for babies.
Okay. Mm-hmm.
Um, and yeah, I think it's also the quality of these conversations. Like, how are these conversations typically going? Because this is not, this isn't the therapist down the street. How are
Yes.
you communicating your value to them?
Mm-hmm, mm-hmm. Yeah, I mean, it's been great because I feel like they've been asking and really interested before I
Hmm.
even say too much about like, well, they typically they know what EMDR therapy is, the other
Hmm.
providers, but they would say like, how does that work? Like with the birth trauma, what's the session look like? Or what are, clients
Right.
coming to see you? What are they like looking for? So yeah, I feel like I'm able to give really good info. And that's how I got into this niche too, is because I just had people randomly with either the perinatal birth traumas reach out and I liked it, so I'm able to
Yeah.
I I have worked with a couple people and this is what it's like, so yeah, I feel like it's been good. Yeah.
And so I think about like the docs that are following those patients,
Hmm.
like using the doc I'm seeing your patient template that's in the What to Say When course, because
Hmm.
that keeps you top of mind. If you send every month, you send a letter of like, here's, it's the template, but basically like, I'm working with so and so, here's their diagnosis, here's like how they're progressing, here's what we're still working on. They
Yeah.
see like, okay, progress is being made. Um, this person specializes in this.
Hmm.
And you can say at the end, like, happy to serve any more of your patients who experience birth trauma.
Yeah.
Um,
Hmm. Yeah, I have not reached out to the doctors, but I have reached out to, like, again, and most of those people on my caseload, they're like talk therapist has referred them to me for the EMDR. So I've reached out to them, like
mhm.
they have another therapist or psychiatrist. I've reached out to them. And it was cool because one of the client's therapists was, she was like so amazed after one session how the client was reacting afterwards. So they wanted to meet and talk about it. And yeah,
Awesome.
that was
So you're
great.
getting great results with
Hmm.
people, and that matters a ton also.
Hmm.
And I think like, if somebody's on an antidepressant or if somebody is depending on the like potential injury, if they're being followed by an OB-GYN, then it would make sense to have them sign a release of information so you can communicate with that person. Because mind and body's not divorced. They're not separate. So
Yes, yeah. Yeah, definitely. I should look out into that's a good way to get in with like the OBs. Yeah, okay. Um, and I was curious too, like with my other when I was doing like recent traumas and PTSD, like acute stuff and EMDR with that, I was ranking pretty high on Google. Like I would do
mhm.
like the incognito search and like I was on the first page for my area and I was not really seeing results from it. So I'm not sure, I don't know what, but it was easy to know, like in my opinion, what keywords to use with all of that. But now with this, I feel like there's so much, like, I don't know what people would be searching, like postpartum support or help. And again, I'm not really necessarily, that's the other thing is the imposter syndrome of like, I don't have kids myself and I don't have any training in perinatal stuff. And I'm getting some, I'm planning
Mhm.
to, but I don't yet. So I'm not the person that's going to do like long term, like, oh, I'm just struggling with postpart, like the depression or even
Right,
anxiety. Like, I would want them to see someone else for that. I'm doing the recent, even if it's not recent, but the one time event of the birth trauma itself.
right.
And I'm just curious what people are even searching for that. Like, I don't,
Yeah, I mean, I think they know the term birth trauma.
okay. Hmm.
So
Hmm.
I think, or traumatic birth, or you could go into some of the birth traumas, like
Yeah.
I've blanked on all of them now.
Sure. No, I know
Could
what
have
you,
told you at
yeah.
least some of them a
Yeah,
minute
yeah.
ago.
Yeah.
Yeah.
Yeah, and I've Googled like I've seen what could come up by just Googling like birth trauma and then I'm like, well then what birth trauma experience, therapy for birth trauma near me, yeah, maybe just a mix of those.
Yeah. Well, and yeah, like fourth degree tear,
Hmm.
like things like that.
Hmm.
My friend had the one, why am I blanking on what it's called? Preeclampsia.
Yep, yep. Mm.
So just like therapy for preeclampsia or therapy for uh there's also all the traumatic births where the mom was fine, but the
Right.
baby was not.
Yep, yep. Or
Um,
just a NICU stay afterwards and
yeah.
yeah. Yeah. Okay. Yeah, I can definitely get more specific. I mean, I'm blogging every week too, like consistent.
Uh-huh.
So I'm able
Good.
to use those words in there too and
Yeah.
do all of that. So, yeah. Okay. Um, And my like the heading or the main tagline on my website, like the first thing people see is therapy for women wanting to process and heal from a traumatic birth so they can enjoy time with their baby in the present moment without being dragged back into the powerlessness of the hospital room. And I was just curious if that sounded good or could be
I
refined.
it's a lot of words. I want to cut
Yes.
down on the words and make it really clear. I like every bit of imagery that you put in there, but not as
Sure.
a tagline.
Okay.
Um, I mean, it could just be simple like therapy for traumatic birth,
Okay.
like
hmm Yeah.
clear is
Yeah.
powerful.
Yeah. Yeah, I think I overthink it a lot and I try to be like, well, what's the thing to catch them,
Uh-huh.
But I think that's niche enough that it doesn't even have to be a huge thing to catch them. They're going to see that and just, yeah.
Right.
Okay.
Right.
Yeah.
Because what catches them is the tagline of like, oh, that's me. And then the way you describe it afterwards.
hmm
Right. And so, and you could have it kind of broken down of
Yeah.
like,
hmm
you know, like NICU stays of
Yeah.
um your own physical healing as a mom,
hmm
concern about your baby's survival. Like there's just so many different things in that day-to-day
Yeah.
experience that's such hell for people that
Mhm.
when you can talk about that clearly helps them, like really helps them
Yeah.
feel seen and known and like you know what you're doing.
Yeah. 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 No, that's good. I can definitely like break it down and yeah, make it less wordy. I was reading it off to myself earlier and I was like, it's kind of long to say.
Yeah.
Yeah, that makes sense.
Yeah. And I would love for you to network with every single perinatal
Mhm.
mood disorder therapist out there.
Mhm. Mhm.
And saying like I end up collaborating with a lot of perinatal mood disorder therapists. I don't treat perinatal mood disorders, but I do
Mhm.
basically time limited EMDR for birth trauma. And that way they know you're not trying to take their client,
Yeah.
um, that
Mhm.
you're just there to like
Yes.
collude with them and help.
Yes. Yeah. And I'm trying, I haven't really done this on my web. I do have a separate, my service pages are like, uh, one thing I learned was to take off EMDR from like the main tagline because I like that's not what people are necessarily looking for. But when
Right.
people read that, that's what I offer for the birth trauma. I think that's been helpful. So like
Yeah.
my services are traumatic birth, and then perinatal grief and loss, and then EMDR therapy, and then adjunct EMDR therapy. So like one page explains EMDR, then one page explains like what adjunct EMDR therapy is. Because I really do feel like the work I'm doing is very adjunct. I'm having a ton of people, or not a ton of people, the caseload's low, but from what I have, people are being referred to me and they're seeing another therapist at the same time for time
Yeah.
limited work with me. And I really like that because I am wanting to do the very specific like uh and usually it's only like a few months when they're with me if it's a one thing we're working on. So I'm trying to see how to like if that should be added into my homepage or how to add that in to be like this is a I don't know, like in an adjunct way, like I'm working, it's very time specific and I even offer 90 minutes that I have in person office 1 day a week to do the 90 minutes. And I don't have anyone signed up for that yet, but I'd love for people to advertise it in a way to be like this can be, especially if you do 90 minutes, like a quicker thing and it's and I don't know how to
Yeah.
if I should even worry about that right now, like adding that into my website or not. I don't know.
I don't know that I'd worry about that right now unless that's the only way you want to do it. Like,
Okay.
because the whole a confused mind says no,
Right,
Maxim.
right.
We want to make it as clean and crisp. And I think about like the typical client who's going to land on your website. She's not looking for you while having a therapist. So I wouldn't put it on your homepage, but I do like having a specialty page that you can send other therapists.
Okay. Yes. So I do have that like as adjunct. So okay, yeah. Trying to make sure I didn't have yeah, and I mean I feel like the other just mainly like just the worried about the fact that anyone who does reach out happens to be on the one insurance that I take. And it's just like, would they have reached out if I didn't take that? And some of them throughout the past year of my own having my practice, my private pay clients are people who like thought I took their insurance. That's why they reached out, but then were okay that I didn't.
Uh-huh.
So it's kind of like, well, I don't want to, get off insurance because that's how I've gotten some of my private pay clients. So
Right.
it's just interesting. I don't know how to go about like, I don't know.
Yeah. And it's, I mean, it's one of those things where your current clients most of them would probably stay with you.
Yeah, I think they would. And I've taught I very much that I
Mhm.
most of them would. But I'm not getting new ones. So
Yeah.
that's where I'm
And yeah, that's why I want to make sure you've got like some consistency in referrals before you make that leap.
Mhm.
Um, because then it's just so much less stressful. You
Right.
know, I don't want you to be
Right.
stressed.
Yeah.
So yeah.
Yes.
And I think the more relationships you develop with these perinatal therapists, because I think they're going to be your bread and butter,
Yeah. Mhm.
the more relationships you form with them, their clients, like, more therapists have that reaction like that one,
Mhm.
of like,
Yeah.
whoa, what did you do? This was amazing.
Yeah. Yeah.
Um,
Mhm.
that's that's just going to be where
Right.
so many referrals come from.
Yes. Yes. And I've done really good at continuing to reach out and nurture relationships like with other therapists. I feel kind of stuck on how to do that with like someone who runs a birthing center or
Uh-huh.
doulas. Like, how do I continually grow that?
Would you be willing to go in and do a talk?
Yeah, yeah. And I think one person said I could even sit in on a class, just like observe, which I would love to do anyways. And
Huh?
um, uh, I know I can tour some of the centers, which I'm planning to reach out and ask to do. Um, yeah, I mean, yeah. So any of those things, but it feels kind of weird to just be like, hey, do you want to meet again for coffee? Like
Right.
later. I mean, it's not that weird, but I don't know. So
Yeah.
like, what will we talk about again? So I don't know.
Yeah. Well, I think that's in the first networking, if you're like establishing like non-work connection, then it's like you're inviting them out again because you like them.
Yeah.
And you can chat about whatever.
Yes. Yes.
And I think about the people that have known you for other things in the past. You can say like, "Oh, I've really sub-niched into this
Yeah.
specialty." So it gives you an excuse to follow back up with them as well.
Right. That's true. Yeah.
Awesome.
Yeah. 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 I'll just have to continue that and
Yeah.
keep
I mean, it
trying.
sounds like you're absolutely on the right track. It's a
Okay.
weird, weird year for referrals. I've
Yeah.
never seen
Yeah.
anything like it. It's not just you.
Yeah.
And I think it's going to be like that first month after COVID hit where like it was dead silent.
Yeah.
And then all of a sudden everybody got walloped.
Yeah.
So
Mhm. Yep.
I
Yep.
think there's going to be an exhale at some point.
Yes. Yeah. And I'm in an area that's very kind of for the private pay rate. So I'm
Yeah.
kind of curious, so yeah, we'll see.
Yeah.
We'll see.
Awesome.
Thank
Amazing.
you
Well,
so
thank you,
much.
Kate. I'll
Yeah.
see you later.
Thanks. Have a good day.
You
Bye.
too. Bye.